Hey everybody, my name's Rebecca. I'm excited to be seeing you guys again for MedSurg 3. Kathy and I are both going to be kind of co-teaching this class, so you're going to be seeing a little bit of both of us. But I wanted to give you guys a little video preview so you know how to get started on the class. So I'm going to go ahead and share my screen. Boom, boom. All right, should be able to see my screen now. Now we are in PNUR 164, which is MedSurg 3. I always like to have you look at the syllabus because I think it's really helpful. It gives you a lot of information. And so on the left-hand side, you can see syllabus here. If you click on it, we have put a hyperlink, or if you want to download it or print it, I don't know if you want, or you can just read through here. So class time and place, Mondays. So every Monday from 8 to noon. I know it seems like a long time for a class, but just like last term, we're going to make it engaging. We're going to make it interactive, and you guys are going to learn a lot. It's going to be in B409, so same place we had MedSurg. Excuse me. Kathy and I are both listed on here. It doesn't have our office hours listed because I don't know if we have specific office hours yet. I know we'll both be on campus for sure Mondays and Tuesdays. We'll put our office hours out to you, but please reach out to us if you need anything. On that note about reaching out, since Kathy and I are both teaching this together, I'm going to ask you guys if you have a question about the class, please send your message to both of us. So just send it to both Kathy and I, because that way the first person available is going to be responding to you. So that gets what you need quicker, and it keeps us both in the loop. So in case there's something going on and you are working with Kathy, but I don't know about it and then you need help from me, it just helps everything to be a little more smooth. So I know it's an extra step, but please, when you message us, just include both of us so that we're both in the loop with what's going on. Again, Amanda's part of the class too. Um, boop, boop, boop. Going down, there's only 4 learning outcomes for this class, but they really encompass a lot of things. We're going to use critical thinking and clinical judgment to apply the understanding of pathophysiology, physiology to the care of clients with a variety of medical and surgical conditions. We're going to use the understanding of the PN scope of practice for current healthcare trends, create a healing environment for patients receiving care in a variety of healthcare settings. We're going to utilize principles of safety, patient-centered care, disease prevention, and develop health promotion plan for patients with medical surgical disorders in a variety of clinical settings. And lastly, we're going to correlate the effects of culture, socioeconomics, race, and religion on healthcare and disease prevention across the lifespan. All right, so your resources, again, F.A. Davis is all you're going to need as far as your specific textbook. You won't have to purchase anything because you've already purchased your F.A. Davis package. We might pull in some ATI pieces, and the concept mapping book is another optional resource for you. I'm going to move down to our week by weeks. So we're going to start off strong, week 1 and 2, talking about the nervous system. First, the central nervous system, and then CVA or cerebral vascular accidents and peripheral nervous system. Then we're going to move into cancer, HIV, and AIDS, then immune system disorders. Week 4 is also going to be when you're going to have your first test. Week 5 is going to be hematologic and lymphatic disorders. Week 6 is GI, both upper and lower disorders. Week 7 is going to have disorders of liver, pancreas, and gallbladder, and that's also where you're going to have test number 2. Week 8 will be our sensory disorders, so think eyes, ears, nose, all that stuff. I feel like I'm doing the head, shoulders, knees, and toes song. Week 9 is going to be emergent conditions, bioterrorism, and a little bit more about that. There's going to be a scheduling difference there. Week 10 is shock and sepsis, and then week 11 will be your final exam. With this class, support grade is still worth 5% of your grade in the class, so make sure to do those assignments. I know Amanda lets you resubmit to infinity and beyond, so it is possible to get all of those points just by continuing to work with it. Everything else, here's the breakdown. So your tests are going to be 30% of your grade. Your final is going to be 20% of your grade. That's pretty standard for your MedSurg classes. Your assignments are going to be 20% of your grade. We've added weekly discussion boards, partially because we've taken away, you don't have an individual project or a group project for this class. We were kind of reflecting on all that you guys are doing with going to so many clinical hours in sim this term, because we're getting you ready to launch and be little baby nurses. And so we didn't want to put the extra stress on you of having to collaborate as groups and do things. So it's just a weekly assignment, and I'll show you a little bit more about that when I click back out of the syllabus. Your support grade, like I said, is 5%. Your weekly quizzes are also going to be 5%. Again, we're going to keep with what we've done, where you can submit that first quiz at the due date before class, but then you have another chance to submit that quiz again for a higher score after you've been to lecture. And then again, we're going to have attendance as 5% of your grade, which is still going to be the KWL forms. Everything else is standard. I'm not going to go over it all because you've seen all of these syllabi a dozen times already. I am going to go back and look at our weekly modules. The homepage looks like our regular homepage. So I'm just going to go here really quick. It might look a little different in my view, but you're going to have like the welcome module will be linked up here. You're going to have the quick navigations. I will add in, I just realized I didn't put in my Zoom room on here. On the days that I am teaching, I will be recording to the best of my ability. And so I'll link the Zoom room up here if you do need to join that. All right, going back to the modules. Boo, boo, boo. So week one, there's a couple of things in here. We tried to be kind of light on the assignments that first week because we know we've got to get them in and done. And because on week two, you're going to have another slew of assignments. So my recommendation is start your assignments now. Get these done before class like you normally would. We're giving you till April 4th to do these first week's assignments, but after that, like on week number 2, they're all going to be due April 7th, which they'll all be due that Monday before class time. So just kind of like it was last term with MedSurg 2, you have to have your assignments turned in for that week before the class time. Okay, so the weekly discussion boards. Kathy has already recorded a video that's wonderful. So it's right in here. I'm not going to play it for you, but what I suggest is that after you watch this, take a minute and go in and watch that video from Kathy. Your discussion boards are worth 15% of your grade, so it's a pretty significant amount. If you watch that and read through the instructions on the discussion board assignment, you're going to be able to do great on them. And it has a pretty specific rubric on the assignment. So look at the rubric. Boo, boo, boo. Again, weekly resources pages are going to have a lot of really good information for you. The PowerPoints and visual aids are going to be there already. We'll upload any recordings or videos that we think, will be helpful to you. I want you to notice that, week 1, there's a fair bit of homework to do on here. Week 2, there's a lot of homework. There's a lot of assignments on here. I don't want you to get discouraged or daunted because you already know a lot about these. Our KWL, we do that in class. That's your attendance credit. You guys are familiar with the review assignments that we have you do. There's other things like compare and contrast or case studies. You know how the personalized learning and FA Davis works as well as the quizzes. And then we've added in the discussion board. I know it's a lot, but I also want to remind you that it's a 6 credit hour class. So we're only meeting for 4 hours in person. So essentially 2 hours of the work are you at home doing some of these assignments, especially the discussion boards. And then remember, for every credit hour, we expect you to probably have about 2 hours of reading and homework that's associated with it. So yes, it seems like a lot, but it is appropriate for a 6 credit hour class that has 2 hours of hybrid work. So just know we're not trying to throw you any curveballs. This is pretty much what it's going to be week to week, except for the weeks that we do have tests. We're a little bit lighter on your assignments. Okay, scrolling down, I do have them listed here where you can see test number 1 and whatnot. I want to show you week number 9. So on week number 9, that Monday, 5/26 is a holiday. So we do not have class that week. But we are asking you to attend class on Tuesday, 5/27. We're going to have a collaborative disaster drill day where we collaborate with the fire program and the EMT program, and we might have a little bit other things in the work. But it is a full 8-hour day where you're actually going to be learning some fire skills. We're going to be going over some like disaster preparation type things. It's a really pretty fun time. But just know, mark your calendars now. It's that Monday's a holiday. Tuesday, you're going to be in class all day. And then we do have our final test on 6/9 that Monday at 8 o'clock. And okay, I think that covers everything. I'm really looking forward to seeing you guys all in class. I've missed you. I hope you're having a good break. And anyway, I'll see you in a little over a week. All right.